Okay, now that we've hit the record button, good morning and welcome to Imico's Maternity Natural Health webinar with Dr. Zali Yager. I'm Julie. I'm stepping in for Kathy again this morning. She's off on an anniversary adventure, so I hope she has a great time and she'll be back again next week. So I'm here today with Dr. Zali Yager, and she's going to give us a little bit of a presentation on the topic of body image, a critical piece of the puzzle in perinatal healthcare and maternal wellbeing. Really looking forward to hearing more about this topic. Sounds really, really important. Body identity is such a massive change for women during this time. Some information that Zali's provided here. The pregnancy, birth and breastfeeding period is one of the great physical body challenges and identity change for women, and yet body image is largely overlooked in maternal health care. In this talk, we will learn more about the relationship between body image and key physical and mental health outcomes for women, plus opportunities for incorporating a body confident approach to your practice as a health professional. Little bit about Dr. Zali. Dr. Zali Yager is a body image expert, advisor and consultant. She's also a mum of 3. After 15 years as a researcher in academia, Dr. Yager became frustrated by the fact that there was so much known that never made it out of the university walls. Zali started the Body Confident Collective to change that, with the aim of getting the best evidence-based information from the researchers out to the people who need it. In particular, the collective focused on getting the things learned in their Body Confident Mothers project out to the world. Welcome, Zali.
Thank you so much for having me.
How are you doing this morning?
I'm pretty good. It seems very early, but that's just because it's overcast here. I'm on the east coast of Australia.
Oh, lovely. I'm in Sydney, so
nice. Yeah,
similar.
Yeah, but at least it's not raining, so
that's right. A little bit of a break from the rain is nice.
Would you like me to get going? Do you want me to
I would love that if you'd like to share your presentation with us and get started. That would be great.
Okay. How's that looking for you?
That's looking fantastic. Yep.
Okay. All right. So I am very happy to be here with you today and to talk through some of our research in, my aim is just to open up the conversation really and to just start talking about this a little bit more. We're talking about body image, but also a little bit about body dissatisfaction and sort of body shame. And those are some of the most common experiences for women in general. And we're going to apply that to pregnancy and the postpartum period today. Because the extent of the changes that happen to our bodies as women, as we, the physiological changes, hormonal, identity changes, body changes in terms of size and shape, the changes that happen through pregnancy are second only to puberty in terms of the rate of growth. And I just find it very interesting that we allow teenagers a bit of time and space to sort of grow and do their thing. But women are expected to sort of go off and have their baby and then come back and be the same person afterwards in terms of the appearance of their body and their identity and all of the things. So this is something that I get very passionate about, and I'll talk about any time of day, even if it is early in the morning. Because it's kind of, although that there are these huge changes in body size, shape, physiology and everything, I do find that body image is something that just doesn't come up in the conversations within maternity care. And it's something that we just want to raise a little bit of awareness about because it is so connected to other major concepts. So a little bit more about me. So I used to be an associate professor at the Institute of Health and Sport at VU, and that's where the majority of the Body Confident Mums research was done. So I've done body image research for the last 15 years. I have a health and physical education background, so I'm not a clinician, but I really came at this topic thinking about, how could we help people to feel better about their bodies? And initially I thought that would be great to channel that into the secondary school space, because that was where I saw most of the issues. So I spent a lot of time trying to figure out sort of what works to build a more positive body image. But then we were working with secondary school students and sort of thinking, it's a bit too late. They've already got all of these issues. And then we started looking with primary school students. It's a bit too late. They've already got all of these issues. And we sort of thought, we can't really get into any spaces below primary school to do any sort of education, and slowly realised that the main way that we could change the body image of young people was to ensure that they were getting more positive attitudes role model to them at home. And so
that's wonderful.
Yes, that then started this whole project that started, so there's 3 of us that do this project, and we all have children about the same age. And so we just started meeting in parks and talking about this. But we were sort of at these conferences just going, why isn't there any research on mums? Like, we'd just been through this process of, going out and coming in and feeling like a different person. And why isn't there any research on this? So we did some.
Wonderful.
And I guess a lot of the first question people ask me, if I'm at a barbecue or something, they'll say, how did you get into this work? And I think that they sort of get a little hunch that I do have some personal experience in this area, and they're right. So I do have, my very first memories of my body was that it was too big. And I have sort of lived experience of being in a larger body, a lived experience of body image and eating concerns throughout adolescence. And then also lived experience of sort of subclinical eating disorders, postnatal depression, parental burnout, all the things. And within our Body Confident Mums team, we have, again, lived experience of anxiety, trauma, depression, clinical eating disorders, all of those things as well. And I think it's really important as researchers that we acknowledge that we have lived experience, and that we bring that to our work, as well as all of the big sciencey stuff.
Yeah, so it makes the research much more focused and directed.
That's right. I just think people think it takes away some of the objectivity, but it actually just helps you get more to the heart of things and do things that matter, which is what I'm all about. But even after becoming this expert on body image, and I thought I'd sort of solved all of the past insecurities, I've been working in the area for 10 years, and then I got pregnant, and actually, I should say, then I gave birth, because I love my pregnant belly. And it's one of, what we find this often with women, it's one of the only times people do love their stomach, and are proud of it, will show it off, wear all of the figure hugging clothes and things. Yes, I should say then I gave birth, because what happened then was I was left with a deflated mess that I was not at all prepared for. And I just remember lying there after having my first baby. I was lying there just prodding my stomach, and it was just sort of rippling and wobbling away of its own accord. And the midwife walked into the room, and I just sort of said to it, when does this go away? I just had no idea that would be what was left after the baby came out. And she just kind of patted her own belly and said, oh, never. And I just kind of thought, now reflecting on that moment, my eldest is 9 now. So reflecting on that moment 9 years later, I just think that was such an opportunity for her to do a little bit of expectation management around how long it could take for me to feel like myself in my body again, and to just do a little bit of I'll have a little chat about it, in the kind of, you might never look like what you did before, having that conversation at that time could be really helpful. Because I think a lot of women are in that situation. They have that belly, and then they go back into a mindset that a lot of us had as young people and teenagers of how am I going to lose this? What am I going to have to do to myself to get rid of this? And starting to sort of plan the diet already when, they've just given birth to a child.
Yeah, and it's a message that we're given very early on in pregnancy: lose the baby weight.
Yeah.
Very commonly promoted.
Yeah, so that moment's really stuck with me, and I then went on to have twins, and that belly after birth was a whole new level of
wow.
but at least I was prepared for it this time, and so I think that's the main thing of people comparing sort of first-time mums and second, third, fourth, is that you're prepared for what's going to happen. And I think we could do a little bit more of that with the first-time mums, in terms of just having realistic expectations of what our bodies are going to do and look like after birth. So in the Body Confident Mums project, we realised 3 key things that sort of really convinced us that body image is a really critical part of maternal care, and yet kind of overlooked. And I'm just going to share those with you now, but we'll just sort of tell stories about it more generally. So the first is that many women struggle with their body image. And this is, in the general population, we know that 90% of women want to change something about their body. 50% have sort of marked shape and weight concerns, which is sort of clinically significant. And 77% of adolescents indicate that they experience body image distress. And so, if we think about the general population, they're already having all these thoughts and feelings about their bodies. And then I just want you to imagine, they go from adolescents, they turn into 20-somethings, and then they sort of turn up in the maternity care system. And so it might not seem like it when you've got, women coming into their antenatal appointments, in their beautiful new maternity gear, rubbing their bellies and very glowing and very happy with how they look in that moment. But so many women have that prior history of sort of significant body dissatisfaction, and also 10 to 20% have had some experience with eating disorders. And I think we think eating disorders are quite rare, and that it's only sort of 1%, but that's the prevalence of anorexia nervosa, which is, one of the lesser prevalent eating disorders. But binge eating disorder is, 10 to 20% of women, and really underdiagnosed. So having those disordered thoughts is very common, particularly around food and eating and weight loss and weight gain. And so when you think of that being so common, and then they're coming into the maternity care system, what that means for their physical and mental health behaviours and outcomes is quite huge. So we know in the general population that being concerned about weight and appearance has implications for every other mental and physical health outcome. So when we looked at the research, we did a systematic review on this, still going because systematic reviews are a little ridiculous really in terms of the amount of time that they take. But we did this review of the literature, and we looked at everything that was related to postpartum body image. And all of the things they looked at, whether there was a relationship, there was a relationship. So things like depression, things like food and eating behavior, things like exercise behavior, even like engagement with sex after having children, parental burnout, parental stress, smoking, eating disorders, all of the things were related. And when we look in the general population, all of those things are related again. And so we know that people who are experiencing body dissatisfaction are 24 times more likely to develop depression. And so, yeah, there's a really strong link there, but a lot of people still kind of put body image in the category of like a frivolous, superficial teenage thing. And that's one of the barriers that we have to overcome in doing this work, is to really point out the extent of the influence of the way we feel about our bodies and the way that we look on everything else that we do. Because particularly women, our body's essential to our identity. And there's a bit of a sort of a slippery slope. So what we see is, women who look in the mirror and you feel like you're not living up to societal standards. Maybe you've just had a baby and you're looking in the mirror and thinking, oh my goodness, You know, I should be bouncing back to something. And that's when we start to see people actually avoiding physical activity because they're afraid of the judgment. They don't want to be wobbling in places that weren't wobbling before. Their gym gear doesn't fit them anymore. So we see avoidance of physical activity. We see lower diet quality, so less fruit and vegetable consumption. And when you start to put those things together, then people start to feel like they're failing at life a little bit. Yeah. One of the we were interviewing this woman, and she was just saying, like, you know, everyone else looked like they had it together, and everyone else, you know, pushing their prams, were well put together with their outfits, and they, you know, lost the baby weight, and it looked like they were being successful. I felt like I was failing as a mum because I didn't look like it was all together. And that's where, you know, the implications of that shame really hit home for me.
It's a very common thought.
Yeah, but then something that often just doesn't get raised, or we don't talk about it. We just think we have to deal with it on our own.
That's right. Everybody thinks they're the only one.
Yes, exactly. But it's like everyone. And so we know then that women avoid those health behaviours. We know that they will then, most of the research shows that people will end breastfeeding earlier so that they can then go and do the sorts of things that they want to be able to do to control their body without worrying about their milk supply. And then also we start to role model all of these things to the next generation.
And it starts again.
Yes, and the whole cycle starts again. So, you know, the implications of this body shame are huge at a personal and an emotional level, but then it also does have this really big impact on our mental and physical health, and on the mental and physical health of our children. And so the third point there is really that if we flip that and we think about body confident practice, this can have really positive implications for the mother, but also for the children. And like most mums, trying to get them to do anything for themselves is like a huge challenge, but if you get them to do it for their kids, and it's something that's possible. And so that's where we really talk about role modeling positive behaviours. We did some research around role modeling and found that women who had a better body image themselves reported being better role models. And so people ask, you know, can you fake it till you make it? And you absolutely can. But in order to be that really good role model, if you actually feel it yourself, it's just so much easier and so much less cognitively taxing to be on all the time and sort of actively role modeling those things. So if we can support women to have those realistic expectations, to engage in the health behaviours, because that's good for their bodies, not because of any sort of appearance related outcome. And if we can support women to improve their body image, or at least don't sort of exacerbate or trigger some concerns throughout their care, then this can have a really positive impact on their mental and physical health. We know in the general population that women who have more positive body image do engage in more physical activity, do eat more fruit and vegetables, do have better mental health, but also do things like wear sunscreen more and go and get pap tests or preventive kind of testing more. Because when you accept your body and respect it, then you will look after it. And a lot of people think it's the opposite. They think that they have to hate it into submission, which is really like the product of growing up in the 80s and 90s, because that's what all of the ads told us to do.
Yeah.
But it's really not that way at all. If you've got a really old car, you don't insure it. And you know, if you don't love that car, then you just leave it out in the hail and the rain. You don't wash it. You don't put the good petrol in it, all of that sort of stuff. But if you've got a really nice car that you love and respect and appreciate, then you do all of the good things for that car. I'm not a car person, but I think it's a good
it's a lovely analogy. But yeah, being more connected to your body, it's just sorry, I'm completely tongue-tied, but yeah, it's about connecting in. I think it's connecting in and feeling the body, and being grateful for it, but also being connected to what it's telling you, and
Yes.
and giving it what it's asking for.
Trusting and listening to the message.
Yes.
Because so many women have actively shut off that communication between the head and the body. And we do that, you know, people who have been on diets or had disordered eating sort of thoughts, attitudes, behaviors, do tend to switch off in terms of listening to the body, because they want more cognitive control, because they want to make sure that, you know, and any sort of diet basically is taking away, you know, listening to feelings of hunger and satiety, and replacing that with like knowing how many grams of this or calories of that you've eaten. And so pregnancy actually offers a really nice opportunity to disrupt that, because we find that women will actually listen to their bodies for once. And, you know, they have that temporary relief of the pressure to be thin, where they will sort of allow themselves to eat things that they might not have eaten before. The aim is
do it
to
for the
continue
baby.
that. Yes, to do it for the
Yeah.
baby. The aim is to continue that and not let that sort of shame, guilt, and all of that sort of thing creep in afterwards when they might have gained a little bit of weight, because we need to talk about how that is physiologically necessary for the baby.
Yes.
So just to bring all this together, what we ended up putting together was this, we're calling it the Nexus model. We don't have a fancy name yet, but when we asked health professionals, what are the two biggest issues in perinatal health care? And when we look at the number of journal articles, when we look at the policy documents, when we talk to health professionals, we hear that the two major things that people are worried about are perinatal anxiety and depression, and gestational weight gain and retention. And there's so much focus on this in, you know, pregnancy care guidelines and all of those sorts of things. And
even when you're getting your pregnancy care, often if you have any weight issues, it'll be really, there's quite a strong focus on that in the maternity care system.
Yeah. But then when we looked at the research for the things that are related to that, or things that predict that, which is a lot of research is that kind of longitudinal, with looking at what sort of factors predict these outcomes, then body dissatisfaction is really highly related to perinatal anxiety and depression. They've done studies now, they don't actually know which way it goes, like whether it's chicken or egg. You know, if you're dissatisfied in pregnancy, then they've found that means you're more likely to have perinatal anxiety and depression in postpartum. But similarly, those who had PND in early postpartum were then more likely to have body dissatisfaction later on as well. So not quite sure which way it goes, but they are just so highly related, and it's because of all of those feelings of hopelessness and helplessness around the way that their body is looking and feeling, the way they can interact with the world. But then also body dissatisfaction is really highly related to the to gestational weight gain and the retention of that. And I don't like calling it that. We actually call it gestational growth, because gestational weight gain sort of has negative connotations, but that's the medical term that's used in all of the policy documents. So we thought we'd include that in our model. But yeah, those outcomes are all related in the research, but then also the behaviours that influence those things are related. So if you have poor body image, you're less likely to engage in physical activity, and then that's going to have a negative outcome for your mental health. That's going to have a negative outcome for maybe some of that gestational growth that's retained afterwards. If you have a poor body image, then you're less likely to be eating fruit and vegetables, which is going to have a negative outcome for depression. So all of these things are related, and what that tells us as body image researchers is that if we do focus on improving the way people feel about the way that they look, it can then have a really positive impact on these big complex health problems. that, you know, a lot of research dollars have gone to trying to change these things, not entirely successfully all of the time.
Yeah.
So when we brought all of that work together, and we've worked with health professionals, worked with midwives, and we've identified a set of what we're calling evidence-based practice guidelines. So this is sort of 6 things to guide particularly antenatal and early postpartum care. And I'll just talk through them more quickly, but on the next slide, I've got a document that you can download to have these with you.
Great, thank you.
The first is to be aware of women's prior experiences. And so that's really recognising that the majority of women have had some thoughts and feelings about the size and shape and weight of their body in the past. And, you know, up to 20% might have had an eating disorder, and just recognising that, you know, they might come into your office for the first time, but that's not the first time that they've thought about their bodies. So the second is to really screen for body image concerns and past eating disorders. And within, you know, in the first booking in appointment, there's often questions about depression, but not about eating disorders. And when we're thinking about, you know, the fact that weight gain is pretty much guaranteed during pregnancy, that's a very triggering event for a lot of women. So it's a good idea to know if there is a past history there. And that can just be through asking very simple questions, which midwives are amazing at, getting women to speak about all sorts of things. So just asking, oh, and in your past, have you had any experience with an eating disorder? It just opens up the conversation, because what we're hearing at the moment is if the question isn't asked, the information won't be shared. And then asking about body image concerns during pregnancy is just, you know, how are you feeling about the way that your body is growing and changing at the moment? So there are some more, you know, there are some screening questionnaires, there are all of those sorts of things. And some of the researchers have recommended that we screen for body image concerns in order to prevent postnatal depression. But just asking those simple questions can mean so much in that moment.
Great conversation starter.
Yeah. The third one is speaking using body confident language. And so that's trying to avoid using the medical terminology around the weight categories, and using things like, you know, someone in a larger body is a much more inclusive way of talking about that. Using gestational growth instead of talking about gestational weight gain. Some of those things can really just change the connotation. Weighing women is something that obviously as body image researchers, we have a lot to say about. And this is a very complex area, because often it's driven by policy decisions, it's driven by layers and layers of different requirements throughout different hospitals, different LHDs, and different states. But what we've done is come up with a little bit of a guide to, you know, if you have to do this because it's required within your system, then there are a few different things that we can do to make it a more positive process. And the first is explaining all of those layers of policy, just really briefly, because what we find is that women have been weighed in those settings, and they think that, again, they think they're the only one. They think it's because they've done something wrong, and then, you know, the principals pulled them in and put them on the scales.
Yeah, they're being judged.
Yeah, and it's very judgmental. So to explain, oh, we just have to do this for everyone. Do you mind to asking permission? Do you mind if we just weigh you today, because it's part of the process of the booking an appointment? And then they know it's nothing to do with them, it's everyone that has to do this. The next thing is to offer blind weighing. So to offer, you know, do you want to close your eyes, or like, you know, as the midwife, you can just put your foot over it and just have a quick glance at the numbers, because often if women see the numbers and they've had issues in the past, they will fixate on those numbers. And that's not so much of an issue at the booking in appointment, but at the ones at the other end.
Later on, yes, yeah.
Yeah, it can be a really traumatic moment.
Yeah.
So doing that, and then just offering a little bit of positive reassurance after the weight, because there's always that vulnerable moment when you're standing on the scales and thinking, is this midwife judging me for what the numbers say? And so just saying, anything nice in that moment is better than saying nothing. But just say, oh, it looks like you and your baby are growing really well, or yep, perfect. Like, even if it's just that.
Yeah,
I
just
think
a nice gentle landing.
it can cover over the vulnerability
Yeah.
and the shame in that moment. And then recording that in a place where women can't sort of, it's not this big number on the screen or something that they're going to be focusing on for the rest of that appointment. So yes, weighing is a big thing. And of course, if you don't have to, then we would say we probably don't need to. But sometimes it is necessary. The next one is to focus on health behaviours rather than weight, because what we see is a lot of people talking about weight, thinking that that will motivate people to engage in health behaviours. So thinking that they need to say, oh, well, you've gained this much weight and that's outside of these guidelines, and sort of giving them a bit of a, there is a finger waggle involved, you know.
Yes. Yeah, there is.
You know, and you know, you really should, oh, it's for the baby, you know, we don't need to layer on the shame in that moment because it's already felt.
Yeah, she's well and truly aware of her situation.
Yes, and we do not need to point it out, because all of the research shows that when we point out weight category that people are in, then it results in very short-term behaviour change, but then mostly disordered behaviours.
Yeah, okay.
And eventual weight gain. So there's no benefit to identifying that. And we've heard all sorts of stories about, you know, the IOM guidelines, categories and how much weight should be gained and things being posted in hospital toilets and places where women can see it in very vulnerable moments.
Yeah, yeah.
And just,
don't need it.
It's really not necessary. If we want to help people to be healthy, we can talk about health behaviours. We don't actually need to talk about weight at all.
Yeah.
So we can talk about, you know, how are you going with fitting in fruit and vegetables into what you're eating. And that's the main first place to go. If we increase fruit and vegetable consumption, then we know other things decrease. So focusing on those health behaviours is always going to be more effective in actually motivating health behaviour change. And the last one is just, if there are opportunities to do so, incorporating or referring to body image programs or resources to help women. And that's things that they could do on their own, or it's things that they could do within their antenatal classes or their all of the postpartum visits and things, and the new parent groups. So we've done some reviews of all of the materials that are out there, and we have some on our Body Confident Mums website as well. So if those things can fit in, and we're working on making them shorter and shorter and shorter and shorter, so they're more and more possible to do. If they can fit in, then we definitely recommend including those.
Great. And do you find that there's many services out there that are addressing this at the moment?
No.
No.
And I understand, like, it's like the school system, the curriculum is crowded. Everyone thinks, oh, let's just sneak this into, you know, the new parent groups. You know, there's so much that we do try to put onto perinatal health professionals, and we're not asking them to do anything extra. What we're asking is just to incorporate this approach within the things they're already doing.
Yeah, yeah, it could make such a big difference.
Yeah, and a lot of people that work in this space are naturally aligned with these sorts of values anyway.
Yeah.
A lot of people have been through their own experiences. They know exactly what these things feel like. But, you know, sometimes when we're in a rush and we're doing things, like, all of the training just comes out instead of sort of thinking about how that woman might be feeling in that moment. So, yeah, definitely understand that this is a challenging space to fit all of these things into, but hopefully just encouraging a little bit of reflection.
Yeah, yeah.
About how we could just consider women's body image along the way. So we've put those recommendations with a little bit more detail into a body confident practice guide. And so if you scan the QR code, that should take you to a page where you can enter your email, and those recommendations will go straight to your inbox. That just gives you a little bit more detail, but also sort of has it written down so that you can go through it again. And I'm really keen to hear from people in terms of how realistic they are and how they've incorporated those into their practice.
Sounds, yeah, I'm definitely going to be downloading this and integrating it into my work. I think that it's actually something that I kind of address in a, in the holistic kind of way that you sort of work with women in these, my work is postpartum. So it's probably a little bit further down the line than I would like to be. I'll definitely be integrating it and seeing what I can do in those early days. I think just such a simple question could really make a very big difference for a woman's postpartum comfort.
Yeah, and so the course that we've put together then dives into unpacking a lot of this research and the relationship in the research a little bit more, and has more detail on sort of practically embedding those guidelines in practice. At the moment, that one is very focused on sort of antenatal and early postpartum, but we are going to be developing one of those for sort of that longer postpartum period, and more for sort of maternal child health nurses and people who work with women over that whole first year and into, we sort of consider postpartum to be up to 5 years really.
Yep.
Because, it doesn't end when they turn 1.
No.
That is coming as well. But I think that when we're talking about postpartum, a lot of that is expectations and just managing, because women still think that after their 6-week appointment that everything will just go back to what it was before. Like, people have in their head the 6-week kind of check is like in their head then when everything goes back. And what we know is that body dissatisfaction actually is the worst at 6 and 9 months postpartum, because they still have, weight that they think they should have lost by now. And then they're trying to go back to work and to fit into clothing that they haven't worn in 18 months. And it doesn't fit anymore. Some of the struggles coming in. And so I think this is really relevant for even people who are like sleep consultants and who are, lactation and working with women around feeding, like starting solids and things, like all of that then starts to become the space where people are really open and receptive to these kind of ideas, because they're starting to really feel that shame from not having lost the baby weight yet. And they're starting to talk about that as one of the main things that comes up in their mothers groups and in their play groups. And then we're just passing all of that into the little sponges that are playing around us.
Yeah.
So this is my contact details, and you can follow us on Instagram as well if you want to kind of keep keep in touch. Please do send me an email if there's anything in particular, but I'm really keen to hear, I don't know if you have the ability to see questions or anything, but I'm just really keen to hear any questions or to see how people could see this fitting within their work.
Yeah. I don't have any questions here yet, but please raise your hand if you've got a question, or pop it in the Q&A box there for Zali, and we'll pass it on.
So yeah, thank you so much for the opportunity to be talking about this today. And I'm very surprised I haven't been interrupted by any children yet.
You've done really well.
Did give them a bit of a talking to before.
Mine are getting ready for school around me too.
Yeah, I can just hear all of the feet running around. But yeah, very happy to have like email chats or conversations afterwards as well.
Wonderful.
And to talk more about how people can fit this into their work. Yeah,
I feel that this is something that was really glossed over during my my experience of having children, and something that I could have personally really benefited from having some just having it on my radar during that time, I think. So yeah. I'm really looking forward to diving into your website and having a look at what else you've got to offer there, and really integrating this into my own work.
Yeah, and we will have coming this year sort of some resources that are in a very easy format for women. We're just doing some research at the moment to figure out what would you actually use? Like, what could you fit into your day? And to figure out some very brief resources that women could just tap into in those moments where they need it. You know, I often find that women report getting dressed in the morning is sort of one of their very vulnerable points, because everyone has to get dressed in the morning, you know? And you're now, you know, time pressure, and you don't have a lot of time to stand there and consider your outfit or try different things on. But that's the moment where women are reminded of, you know, any sort of weight gain that they've had. That's the moment where they feel that shame. That's the moment where they just put on that one outfit that they've been wearing for the last 6 months. So yeah, I think that's something that, you know, you could at least have some conversations about.
Definitely. I've got a comment here from Serena. She says, thank you so much for such an insightful webinar. I'm looking forward to taking a look at your website for further information. From Serena in the UK.
Oh, lovely. Thank you so much. That's very kind.
And Madeline says, great information and lots to reflect on integrating this into postpartum care. Thank you.
Yeah, I do think postpartum doulas in particular are just in the best position to be doing this work, because you get the time and the space to really, have those conversations. And you mentioned, like, people think that they're the only one, and I think that's a really important thing. If you can do nothing else, just to get women to understand that this is a very common experience and that they're not the only one. We know that that fits into one of the main models for, I think, addressing some of this, particularly with women, is self-compassion. Part of enhancing self-compassion is, you know, feel the feeling, realize that you're not the only one feeling that feeling, and then do something.
Part of the human condition.
That's right. There's common humanity that, like, every other woman who has ever, you know, birthed a child has felt the way that you're feeling right now. And I think that just having that message out there.
It sounds like a really wonderful topic that could be addressed through peer support in some way. I mean, what we find at the moment is that women in those conversations, they sort of slip back into talking a lot about diets and talking a lot about before and after photos and talking a lot about the things that they hate about their bodies. But I think that if someone was brave enough to redirect the conversation and just say, but look at what our bodies have done for us. Such a marvel. Well, thank you so much. It's time for us to finish up now. I think we've covered all of the questions, and that was just such a wonderful webinar. Thank you so much. Thank you to everybody for listening. We'll see you next week.
All right,
Kathy will be back next week. Thank you. Thanks. Bye-bye.